like to again congratulate the community and the government, both state and federal, on the great results that we're seeing in flattening the curve in Western Australia and throughout the country, using our natural isolation as our advantage now. I think the community, certainly the medical profession, starting to feel a sense of confidence that we will get our preparations in place in time for any significant caseload, and hopefully we'll be able to really control those numbers very tightly to avoid unnecessary deaths and mayhem and destruction for our economy as well as for our healthcare system. As we start to inevitably then see the pressure come on to talk about reinstituting some of the things that we've had to slow down as a society, the AMA would like to suggest that this needs to be done differently. It's not just rolling back the clock to where we were in December. So if, for example, we start talking about going back to school, as the government's doing today, we know that it has to be done with a different emphasis on health and the structure, the way that it's going to be delivered. So, for example, we would like to see fever testing, we would like to see rigorous cleaning on a frequent basis of areas where students go, rotation of classes and reduced class numbers overall. So it's not just going back to the way that things were before. In terms of the teachers, a particularly vulnerable group that need to be protected, it's very hard to have that social distancing there, and they may have their own view about what kind of PPE, what kind of protective equipment that they want to feel safe in their workplace, not just for a short period of time, because we're all going to be in this for a long haul until we get to the exit strategy, which is going to be a vaccine which could be many, many months away. This is also true around important hospital work that has been delayed. It's another example of something that we can't put off forever, and we need to start having a conversation around the people who are suffering as a result of that, and how we can safely, cautiously, reversibly and effectively start to look at ways of helping people who, for example, need tests and investigation to rule out cancer, or who have chronic pain conditions that just aren't going away and are getting worse. Those are the kind of things we need to look at slowly reintroducing if the personal protective equipment allows. And as we've heard from the government and as we've seen from the initiatives of the Minderoo Foundation, it's possible to now start getting some of that protective equipment. We are, of course, wanting to see a lot of empathy, flexibility towards our frontline healthcare workers in regards to the use of masks and so on. This isn't a time to be inflicting harsh rules on people. We don't want people wasting the high-end equipment, but the low-end surgical masks, we think, should be available to those who need them, either for their own physical condition or because their workplace is unpredictable and social distancing is difficult, or because they simply want to protect their patients. So we just want a lot of empathy, a lot of flexibility, a lot of two-way discussion between the managers and the frontline workers.